Good morning, everybody. I'm reaching out to you on a Saturday for a change. I'm trying to get back to a regular schedule, but life happens. And while life happens, the government happens. And that's what I'm coming here to talk to you about this morning. Look, I know you guys have been hearing rumors. I know you've been seeing weird stuff posted about how the president has destroyed Medicare and we're going to have rising drug costs. Holy cow, the sky is falling. What the heck am I going to do? So, hey, you know what? It's you guys' lives. It's also my livelihood that this affects. So I owe it to both myself and to you to dive deep into what Donald Trump has done to my Medicare. So what I'm going to do today is bring you the research that I've done over the last few days regarding what in the wide world of sports Donald Trump has done to my Medicare. So, after a little bit of research, it looks like he, in one executive order, got rid of 3 of Joe Biden's executive orders regarding ACA, Medicare, and Medicaid. So, I'm going to look at, first off, his executive order, Donald Trump's executive order. Then, I'm going to look at the 3 executive orders affected, and we're going to look at Section 2, which in each of these executive orders is what exactly they're supposed to do, when they're supposed to do it. And then we're going to see how that affects you and me. And then I'm going to draw some conclusions at the end. All right. Here we go. First off, the very first week after Donald Trump was elected, he proceeded to just go crazy with that pen. All right. I don't care which side of the aisle you fall on. There were a lot of executive orders. Looking through there were numerous ones about immigration, the military, blah, 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 right? I found one that affected healthcare in general, specifically Medicare, Medicaid, and the Affordable Care Act. That is Executive Order 14,148. Now, literally, each of these are in the National Register and in numeric order. So, 14,148 rescinded a ton of Biden's executive orders. Now, at the end of the day, there were 3 that I'm going to discuss. There were countless. The rest did not affect healthcare at all, but feel free to look at it. Like I said, Executive Order 14148. Easy Google search. So, the first thing it rescinded was Executive Order 14,009. The name of that executive order was Strengthening Medicaid and the Affordable Care Act. Now, I'm using some truncated quotes because, quite frankly, Section 2 is like that long, and I'm just not reading all to you. Okay? So, but the quote, in light of the exceptional circumstances caused by the ongoing COVID-19 pandemic, the Secretary of Health and Human Services shall consider establishing a special enrollment period for uninsured and underinsured Americans to seek coverage through the federally facilitated marketplace. All right, so for those of you that may or may not be familiar with how the ACA works, you have to go through the federally facilitated marketplace, the FFM. Healthcare.gov, where you pick a plan. Now, a lot of times, agents like myself will help set you up on that plan. And if you don't enroll during open enrollment period in pretty much any healthcare plan, if you want enrolled, you have to use a special enrollment period. So to relate it back to, your work insurance, you had to have a life-changing event. That's generally the biggest special enrollment period. A birth, a death in the family, a change of address for Medicare, things like that. And so in this case, it says shall consider establishing an SEP, special enrollment period. And guess what? They did. And it's now been codified in as part of how the ACA works. If you or your family makes less than 150% of the federal poverty level, you are eligible to enroll pretty much at any time in the ACA. All right. Now, for the large majority of you, this doesn't affect you at all, but this is healthcare and what Trump did to it, okay? But this is done. This is part of how the ACA works now. So, okay, done. So what did this do? Well, removing 14,009 is like, I don't know. It's already, what it was put in place was to consider doing X, and that X has been done. So to continue, Executive Order 14,070, continuing to strengthen Americans' access to affordable quality health coverage. Shall review agency actions to identify ways to continue to expand the availability of affordable health coverage. Okay, so we're going to review agency actions. And it's literally their actions to identify ways to get better access. So, and that was done in 21. So we're already, that's already done, and it's just a review. No effect on you by removing it. Finally, we have the one that most folks are worried about. That's removing Executive Order 14,087. Lowering prescription drug costs for Americans. Whoa, wait a minute. I don't want somebody lowering drug costs for me, right? Heck no. But here's what it says. Consider whether to select for testing by the Innovation Center new healthcare payment and delivery models that would lower drug costs and promote access to innovative drug therapies for beneficiaries enrolled in the Medicare and Medicaid programs, including models that may lead to lower cost sharing for commonly used drugs and support value-based payment that promotes high-quality care. Oh, whoa, whoa, whoa. Don't be removing that. I mean, I want lower cost share, especially for commonly used drugs. And value-based payment sounds good. I'm not quite sure what they mean. Forgive me. But it sounds great, right? Especially for high quality care. I mean, I don't want to pay more. Oh, you know what? But here's the line that I hadn't seen before. The secretary shall, not later than 90 days after the date of this order, submit a report. Oh, and when was this order done? Oh, 2023. 24, 25. Wait a minute. That's like 400 days ago, 500 days ago. That's more than 90, right? So that report's already in? Oh. So that's already been submitted. All right, look. As you can see, all of the actions outlined have already been accomplished. Say what you want about the actions. Anyone telling you that he has done anything different up to now, however, needs to do their own research. And I encourage you to do your own research. Each of these executive orders is public record, and a quick Google search will tell you exactly what I've just gone over. Matter of fact, I'll even tell you what I used. So, NPR had a nice little list of every executive order that Donald Trump has passed since he got elected. Then it went through with a link to those executive orders, telling exactly what they did. It also summarized and then told what it affected off to the far right. So I'm not gonna lie, I did rely on some of their research. But then I went in and looked through. And I just simply used the National Register that actually has these executive orders. So, look, I'm not going to say that Executive Order 14148 wasn't some political grandstanding, because let's face it, it was. I mean, it's the government. They're always going to do something to make it look like they're doing something. But remember, the Inflation Reduction Act is a law. Congress is the only one that can rescind a law. Donald Trump himself simply can't executive order it away. So that $35 insulin, that $2,000 max out of pocket, you don't have to worry about. And so, once again, folks, live healthy, live wealthy, and let's age well together. Thanks.